So good day everyone. My name is Macy Castañares and part of a group 3, and for today we are going to present to you the different kind of agents under the pharmacology studies. And first we are going to present is the agents for HIV and AIDS reported by Ms. Alboris and Mr. Cañada. Next will be the anti-hepatitis B agents reported by Ms. Cabatuan and Ms. Tormes. The third one is the anti-hepatitis C agents reported by Ms. Grenga and Ms. Castañares. The fourth one is the locally active antiviral agent will be reported by Mr. Santiago and Ms. Castañares. And lastly, we have the antifungal agent systematic antifungals will be reported by Ms. Bayala and Mr. Alistair. So let's get started.
Agents for HIV and AIDS. What is HIV and AIDS? The HIV is human immunodeficiency virus. It attacks the body immune system. And AIDS, and if it's not treated, it can lead to AIDS or acquired immunodeficiency syndrome. So AIDS is a term that can only be used when HIV has caused severe damage to the immune system. Public education about AIDS. So AIDS was first diagnosed in the early 1980s. It was found in a certain population in New York where the people there were homosexual, drug users, and debilitated persons with poor hygiene and nutrition habits. It also been discovered that HIV infection is rampant in many African countries and it spread out throughout the United States. An HIV vaccine is currently studied and offers hope for preventing the disease in the future. HIV resistance. HIV drug resistance is caused by changes in the genetic structure of HIV that affect the ability of drugs to block the replication of the virus. Contradiction and cautions. No, there are no adequate studies of non-nucleoside reverse transcriptase inhibitors in pregnancy, so it is suggested that women not breastfeed if they are infected with HIV, for the safety of use of the laverdine in children has not been established. So here are the adverse effects most commonly experienced with these drugs when we take antiviral or anti-HIV drug. They can experience GI-related, dry mouth, constipation or diarrhea, nausea, abdominal pain, and dyspepsia. Dizziness, blurred vision, and headache have also been reported. A flu-like syndrome of fever, muscle aches and pains, fatigue, and loss of appetite often occurs with the anti-HIV drugs, but these signs and symptoms may also be related to underlying disease. Clinically important drug-drug interactions. So when we take Delaverdine, there are drugs that should not be combined with because it can lead to life-threatening effects. Also, St. John wort should not be used with these drugs. A decrease in antiviral effects can occur. So how it attacks the immune system. So HIV attacks the helper T cells or CD4 cells within the immune system. It enters the helper T cell, it copies the RNA and produces a double-stranded viral DNA. And it slides the chromosome DNA to change the cell process and produce new virus. So upon release, they find a new cell to invade and process begins again. So it eventually, as more and more viruses are released and invade CD4 cells, the immune system loses an important mechanism responsible for propelling the immune reaction into full force when the body is invaded. So loss of helper T cell function causes acquired immune deficiency syndrome, which is AIDS. So when the immune system is depressed and unable to function properly, it can lead to infections and cancers that occur when it can lead to infections and cancer. So the treatment of AIDS and ARC has been difficult for two reasons. Number one, the length of time the virus can remain dormant within the T cells, and number two, the adverse effects of many potent drugs, which may include further depression of the immune system. So the non-nucleoside reverse transcriptase inhibitors, it is a inhibitor direct effects in the HIV virus activities within the cell. So NRTIS available include Delaverdine, Descriptor, Efavirenz, so Sustava, Etravirine, Entolens, and Nevirapine, Viramun, and Ripivirine Idarant. So the NRTIS bind directly to HIV reverse transcriptase, blocking both RNA and DNA polymerase activities. They prevent the transfer of information that would allow the virus to carry on the information of viral DNA. As a result, the virus is unable to take over the cell and reproduce. So here are the drugs of the nucleoside division kinase inhibitors, the drug name, dosage route, and its usual indication. Now you can see here the protease inhibitor, so it is the drug name, dosage route, and usual indication. And also the fusion inhibitors, it has a drug name, dosage route, its usual indication. The CCR co-receptor antagonist, its drug name, its dosage route, and usual indication of this drug.
Fusion inhibitor. This is a new class of drug called the fusion inhibitor, and this was introduced in 2003. This agent acts at a different site than do other HIV antivirals. So, fusion inhibitor, iya i-prevent ang fusion or entry sa virus with the human cellular membrane, which mauto siya ang prevent sa HIV-1 virus from entering the cell. Infuvertide fusion is used ni siya in combination with other antiretroviral agents to treat adults and children older than 6 years who have evidence of HIV-1 replication despite ongoing antiretroviral therapy. So, ang infuvertide is contraindicated with hypersensitivity to any component of the drug and in mothers who are breastfeeding their baby. Caution in the presence of lung disease and pregnancy. Pharmacokinetics. Route is subcutaneous, onset is slow, peak is 4 to 8 hours, and half-life is 3.2 to 4.4 hours. Unya mo metabolize siya in the liver, tissues recycle the amino acids and not excreted. Ang iyahang adverse effects are headache, nausea, vomiting, diarrhea, rash, anorexia, pneumonia, chills, injection site reactions. CCR5 co-receptor antagonist. This is the maraviroxelzin 3. It is a CCR5 co-receptor antagonist. What does it do is that iya i-block a receptor site on the cell membrane to which the HIV virus needs to interact to enter the cell. So, kato siya is necessary man for the HIV to enter the cell. So, once na ma-block na to ang iyang receptor, the HIV cannot enter the cell and dili na makamultiply. This is indicated for the treatment of HIV in adults as part of combination therapy with other antivirals. Maravirox should not be used with known hypersensitivity to any component of the drug or by mothers who breastfeed. Caution should also be used in the presence of liver disease or co-infection with hepatitis B because naani siya risk of serious hepatic toxicity. Patients at increased risk for cardiovascular events or with hypotension should be monitored very closely if this is the drug of choice for them. Pharmacokinetics. Ang iyang route kay oral, onset is slow, peak is 0.5 to 4 hours, half-life 14 to 28 hours, metabolized in the liver, excreted in the feces and urine. Adverse effects, dizziness, paraesthesias, nausea, vomiting, diarrhea, cough, upper respiratory infection, fever, musculoskeletal symptoms, hepatotoxicity. Integrase inhibitor. The drug raltegravir, isentres, belongs to this class. Raltegravir inhibits the activity of the virus-specific enzyme integrase, an encoded enzyme needed for viral replication. So, i-block niya ang kanina enzyme para ma-prevent ang formation of the HIV-1 Pro virus and leads to a decrease in viral load and increase in active CD4 cells. This is reserved for use in patients who have been treated with other antivirals and naay evidence of a return to viral replication. Caution should be used if the patient is at risk for rhabdomyolysis or myopathy and during pregnancy. Pharmacokinetics, route is oral, onset is rapid, peak is 3 hours, half-life is 9 hours, metabolized in the liver, excreted in the feces and urine. Adverse effects, headache, dizziness, nausea, vomiting, diarrhea, fever, and rhabdomyolysis. The nursing considerations for patients receiving agents for HIV and AIDS. Assessment, history, and examination. Assess for contraindications and cautions to the use of these drugs. I-check na to if naaba siya any history of allergy to antivirals to avoid hypersensitivity reactions. Perform a physical assessment. Assess level of orientation and reflexes. Examine the skin. Check temperature. Evaluate hepatic and renal function test. So, nursing diagnosis related to the drug therapy might include the following. Then, evaluation. Monitor patient response to the drug, then monitor for adverse effects, evaluate the effectiveness of the teaching plan, then monitor the effectiveness of comfort and safety measures and compliance with the regimen.
About anti-hepatitis B agent. And before we know about what drugs that can help prevent the hepatitis B, well, I'm going to explain that what could be the possible ways that the person could get it. So first, hepatitis B is a potentially life-threatening liver infection caused by the hepatitis B virus or HBV. It is a major global health problem. It can cause chronic infection and puts people at high risk of death from cirrhosis and liver cancer. Antiviral medicines can stop or slow the growth of hepatitis B virus and help prevent serious liver problems. Interferon stops the growth of the hepatitis B virus over the long term in about 35 out of 100 people. So, wa jud siya nakatunga. Although preventable by vaccination, hepatitis B infection is a common affecting more than 350 million individuals worldwide. Chronic hepatitis B infection is associated with the complications of chronic liver diseases including cirrhosis and hepatocellular carcinoma. Current agents designed to target hepatitis B are hindered by the development of resistance, poor tolerability or limited efficiency, and demand for new agents and strategies continues. This review focuses on telborivide, a novel agent in the fight against hepatitis B. Hepatitis B symptoms may include short-term hepatitis B infection doesn't always cause symptoms, so dili jud ta makafila na once magpa-test na ta. For instance, it's a common for children younger than 5 years old. Pwede sad ta magka-jaundice, our skin whites turns into yellow, light-colored poop, fever, fatigue that persists for weeks or months, stomach trouble like loss of appetite, nausea and vomiting, belly pain, and joint pain. Symptoms may not show up till 1 to 6 months, so dili jud ta makafeel ana og naabataan na we can catch the virus. You might not feel anything. About a third of the people who have this disease don't. They find out only through a blood test. So makabalo na sila once they get a blood screening called hepatitis B screening. The most common ways to get hepatitis B include sex. You can get it if you have unprotected sex with someone who has with it. Your partner's blood, saliva, semen, or vaginal secretion enters your body. Sharing needles. The virus spread easily via needles and syringes contaminated with infected blood. Accidental needle sticks. Contact with human blood can get it this way. Mother-to-child pregnant women with hepatitis B can pass to their babies during their childbirth. So it is important if we have a sex to someone, so we must use condoms so that we can get it if we are not so sure. Okay, this is the hepatitis B treatment. Adifovir, difoxivir, interferon alpha, entecavir, so padayon lang ta. Adifovir, difoxivir, this drug which you can take is as a tablet, works well for people who don't respond to lavinovide. So gamito ni siya if ang lawas sa tao dili mo respond sa drug nga named lavinovine. High doses can cause kidney problems. So, kung mapalabian na to, so, atong kidney kay madaot. See also warning section. Entecavir is used to treat long-term hepatitis B infection. Long-term infection can cause liver damage, rarely liver cancer and liver failure. Entecavir helps to decrease the amount of hepatitis B virus in our body. It is unknown if this medication lowers your chance of getting liver cancer or liver damage. Entecavir is an antiviral that belongs to class drugs known as hepatitis B virus nucleoside reverse transcriptase inhibitors. Entecavir is not a cure for hepatitis, so dili siya maka-cure sa hepatitis B. It does not prevent the spread of the virus to others through sexual. So dili siya maka-prevent kung makig-sex ka sa mga tao dayon naka-hepatitis B. Makakuha gyapon ka sa hepatitis B through blood flow with contamination such as sharing used needles. This medication by mouth on an empty stomach at least 2 hours after a meal and 2 hours before the next meal, as directed by the doctor, usually once daily. If you are taking entecavir oral liquid, carefully measure your dose with the medicine spoon provided. Do not use household spoon, so dili ta mo gamit og mga kutsara sa atong panimalay kinahanglan sa ospital jud gikan. Swallow the medicine directly from the measuring spoon. Do not mix the medication with water or other liquids. Rinse the spoon with the side effects. Pwede ta magkaluya, maglabad sa ulo, fever, increased cough, nausea, vomiting, diarrhea, or gas may occur. If any of these effects last or get worse, tell a doctor pharmacist immediately. Remember, entecavir This is taken once a day with a few effects is considered the frontline treatment. Inticover helps to decrease the amount of hepatitis B virus in our body. It is unknown if this medication lowers your chance of getting a liver cancer or liver damage. So Inticover prevent nga dili ka magka liver cancer or magka-liver damage. Inticover is an antiviral belongs to the class of drug known as hepatitis B nucleoside reverse transcriptase inhibitors. Inticover is not a cure for hepatitis, so dili gyapon siya maka-cure sa hepatitis B. Take this medication by mouth. Mouth. So oral gyapon siya at least 2 hours after meal and 2 hours before the next meal as directed by the doctor or the physician. If you are taking Inticover oral liquid, carefully measure the dose to the medicine spoon provided. Wag gyapon dig pareha gyapon siya, dig gyapon siya pwede gamiton spoon sa balay. The dosage is based on a condition response. For children, the dosage is also based on weight. Side effects. See also warnings. Mura gyapon siya na headache, tiredness, dizziness, nausea may occur.
Interferon alpha, entrin A, interferon A, silicon. These drugs boost the immune system in our body. It is taken for at least 6 months. This medication is used to treat various cancers and also viruses such as infection in hepatitis B. Interferons are man-made versions of proteins that our body makes. This drug works with our immune system and strengthens it to attacks against viruses and cancers. It slows down the growth or spreading of the viruses in our body. This medication is given through intramuscular, intravenous, or sometimes subcutaneous injection. Before using, never shake the medication container, the vial or the syringe, because it decreases the effectiveness of the drug. Before using, check if there are any discoloration or there are floating particles in the drug. If there is any, do not use the liquid. Never use single-use syringes. It is okay to use multi-dose pen. It is best used in the evening before bedtime to reduce side effects. Side effects or adverse effects of this drug is on the injection sites such as pain, swelling, or redness. These symptoms usually last about 1 day after injection and improve or go away after several weeks of continued use. In the side effects of having a dry mouth, you have to drink plenty of water to intervene it. Temporary hair loss may occur, but natural hair growth returns when the treatment has ended. The lamivudine, 30C Apivir A or F, Apivir HBV, or Heptaver is a drug that comes as a liquid or tablet taken orally once a day. It is not a cure for hepatitis B nor prevent the passing of hepatitis B to others, but this is NRTI or nucleoside reverse transcriptase inhibitors that works by slowing the growth of the virus and decreases the liver damage that is caused by the virus. Rarely, lamivudine HBV causes severe liver problem or acidosis, or the buildup of lactic acid on the blood. And these side effects will occur more often in women and obese patients. Pegylated interferon or Pegasix. It is a long-acting interferon injected in the body, usually once a week for 6 months to a year. This drug can be used alone or in combination with other medications to treat hepatitis B, hepatitis C, and other infections in the liver. It works by decreasing the hepatitis virus in our body and helps our immune system fight against the viruses. Hepatitis infections can lead to cirrhosis or severe liver damage and liver cancer. Subcutaneous injection is used in the abdomen or thigh. Before injecting the dose, make sure that the injection site is cleaned thoroughly with rubbing alcohol. Changing the injection site each time can lessen the injury in the skin, and never shake the medication. It has the same side effects with the interferon alpha. You can lessen the side effect by injecting the medication at bedtime and using fever reducers or pain relievers such as acetaminophen before each dose. Next is tilbivudine or Tyzeca. It is used to treat long-term hepatitis B infection. It helps in decreasing the amounts of hepatitis B virus in our body. It belongs to the drug known as HBV nucleoside reverse transcriptase inhibitors, where it doesn't literally cure hepatitis B infections or stops the spreading of the virus, but instead it slows down the growth of the virus in our body. This drug can be taken orally once a day. The tenofovir alafenamide or Vemlidy. These tablets are taken orally with food for 6 to 12 months. This drug works by stopping or slowing the growth of hepatitis B virus in our body. Before starting the treatment with this medication, the doctor will test you for HIV infection. If you are positive for HIV infection along with hepatitis B infection, tenofovir alafenamide should not be used alone, for it will make the treatment in HIV more complicated. Side effects are headache, tiredness, cough, and also can cause severe or fatal liver problems. Allergic reactions to this drug include rashes, itching or swelling, especially in the face, tongue, or throat, severe dizziness, and trouble breathing.
So, anti-hepatitis C. So, before I start discussing about the drugs for hepatitis C, I will give some quick review about what is hepatitis C. So, what is hepatitis C? It is a liver infection caused by the hepatitis C virus or the HCV. It is spread through contact sa blood gikan sa mga infected person. So, is hepatitis C curable? Today, chronic HCV or hepatitis C virus is usually curable with oral medications taken every day for 2 to 6 months. But still, about half of the people with HCV don't know if they are infected, mainly because they have no symptoms, which can take decades to appear. This may not prevent the spread of hepatitis C to other people, but it works by decreasing the amount of hepatitis C virus or HCV in the body. So, most liver transplants performed in the United States are due to progressive liver disease caused by the hepatitis C virus or the HCV infection. After the initial infection with the HCV, most people develop chronic hepatitis C, and some will develop cirrhosis of the liver over many years. People can get HCV in a number of ways, including exposure to blood that is infected with the virus, being born to a mother with HCV, mag-share of needle, having sex with an infected person, sharing personal item sa mga infected sa virus such as a razor or toothbrush, and spoons, fork, and lastly is from unsterilized tattoo or piercing tools. Tapos, gamiton na sa siya sa lain nga person without hepatitis C. So, in ana nga way, ma-transmit na to ang virus from one person to another person. So, the two drugs for the hepatitis C are the boceprevir, in generic name, and its brand name is Victrelis, and the other one is the tenofovir or the Encivic. Tenofovir is the generic name, while the Encivic is the brand name. So the boceprevir or the Victrelis, it is taken orally thrice a day for 7 to 9 hours intervals for the adults. And for the tenofovir or the Encivic, it is also taken orally for 3 times a day or thrice a day at 7 to 9 hours intervals with food for the adults. And their treatment of hepatitis C in adults with compensated liver disease must be given with peginterferon and ribavirin. So, inom ka ato nga mga tambal, kailangan imo siyang dunganan og peginterferon o ribavirin. For the boceprevir it is 800 milligram, and for the tenofovir is 750 milligram. But ang kani siya nga mga tambal is discontinued due to recent developments in treatment for HCV and dwindling demand for the drug para sa Boceprevir, while the other one, the Telaprevir, it is being discontinued by the Vertex Pharmaceuticals kay primarily due to available alternative treatments and diminishing market demands. And both of the drugs are under the drug class HCV protease inhibitors. They are oral drugs that must be taken with katong giingon ganina peginterferon and the ribavirin. Neither should be used in pregnancy because na possibility that is it is risk for the fetus, so na possibility nga if inig-inom nimo ng mga tambal kay maapektuhan ang imong baby or ang fetus. And safety has not been established for use in patients who also have hepatitis B and or with HIV infections.
My name is Macy Castañares. So this will be the continuation of anti-hepatitis C agents. So here we have the adverse effects. So the adverse effects, which is the commonly like headaches, fatigue, nausea, diarrhea, bone marrow suppression, and severe skin reaction can occur. Next, we have the locally active antiviral agents. So some antiviral agents are given locally to treat local viral infections such as the herpes, fever blisters. So in the antiviral agents, we have the docosanol, the ganciclovir, the imiquimod, the penciclovir, and the trifluridine. So in the under of the locally active antiviral agents, we have the therapeutic actions and indication, contraindication, and cautions, and the adverse effects. So in the therapeutic actions and indications, these antiviral agents act on viruses by interfering with normal viral replication and metabolic processes. They are indicated for specific local viral infections. So as what the statement said, specific. So depende na siya kung naba na din sa imuhang. Like for example, katong herpes, naba ni sa imuhang genitalia, sa imuhang hidapit, or something in the somewhere in your body. And next we have the contraindication and caution. So locally active antiviral drugs are not absorbed systematically, but caution must use in patients with known allergic reaction to any tropical drug. So dapat, like for example, if na ay like the like fever blisters. So if you have kanang once before mo hatag og medication or drugs ang doctor, i-assess pa man kaana una kung unsay mga allergic reactions nimo so that they will be aware. Next, we have the adverse effects. So because of these drugs are not absorbed systematically, the adverse effect most commonly reported are local burning, stinging, discomfort. This effect usually occur at the time of administration and pass with time. So for example, have the genital herpes as an example. So genital herpes can cause pain, itching, and sores in your genital area, but you may have no signs or symptoms of genital herpes, but it is already if it's infected, you can be contagious even if you have no visible source. Next, we have the nursing consideration for patient receiving locally active antiviral. So in this nursing consideration, so first we have to assess getting the history and examination for the patient, and you have to assess the history if naaba siya allergy nga para ma-avoid in responding the drugs and performing the physical assessment to establish baseline data and evaluating the effectiveness of drug and the occurrence and the adverse effects associated with drug therapy. So next we have the also we are going to assess the infected area para mahibaw-an nato kung unsa kadak-a siya, kung unsa siya nga character nga lesions niya, so that you will get a lot of information para ma-evaluate nato ang ihang drug effects. And also evaluate the signs of inflammation at the site of infection to ensure safe use of drugs. So we have to evaluate.
Okay, so to continue on our locally active antiviral agents, we will have our nursing diagnosis. So nursing diagnosis related to drug therapy might include the following. So it would be your acute pain related to local effects of the drug and the patient's deficient knowledge regarding drug therapy. So as a nurse, you must consider the risks, and the risks are the following stated in the presentation. So implementation with rationale. So what's the purpose of this? Why is this needed? So in order to implement any given action towards the patient, we must have a rationale, or in simpler terms, we must have an explanation. Every action has an explanation. So the following should be considered and implemented. So it is to ensure proper administration of the drug, to improve effectiveness and decrease risk of adverse effects, to stop the drug if severe local reactions occurs, or if open lesions occur near the site of administration, to prevent systematic absorption and adverse effects, to instruct the patient about the drug being used, to enhance patient knowledge about drug therapy, and to promote compliance. So, to include as a teaching point the fact that these drugs do not cure the disease but should alleviate discomfort and prevent damage to healthy tissues. To encourage the patient to report severe local reaction or discomfort. So next would be your evaluation. If we implement an action towards the patient, we must also evaluate. So evaluation is a very crucial part in the procedure, especially when giving patient drugs. So the following should be considered. So monitor patient response to the drug and the alleviation of signs and symptoms of viral infection. Next would be to monitor for adverse effects such as local irritation and discomfort. To evaluate the effectiveness of the teaching plan, such as patient can name the drug, the dosage, proper administration technique, and adverse effects to watch for and report to a healthcare provider. And lastly would be to monitor the effectiveness of comfort and safety measures and compliance with the regimen. Next would be the drugs used here in the locally active antiviral agents. So the given are docosanol, ganciclovir, your imiquimod, penciclovir, and your trifluridine. So here you can see the drug names and their usual indications. So first would be your docosanol. So docosanol, this drug was approved as a cream for oral herpes after clinical trials by the FDA in July 2000. It was shown to shorten the healing by 17.5 hours on average. So 95% confidence interval and 2 to 22 hours in a placebo-controlled trial. So for your ganciclovir, this is an antiviral medication used to treat cytomegalovirus infections, or your CMV infections. So ganciclovir was patented in 1980 and approved for medical use in 1988. So for your imiquimod, it treats genitals and anal warts by increasing the activity of the body's immune system. So imiquimod 5% was approved for medical use in the European Union in September 1998. And your imiquimod 3.75% was approved for medical use in the European Union in August 2012. So for your penciclovir, penciclovir is a guanosine analog antiviral drug used for the treatment of various herpes virus infections. So it is a nucleoside analog which exhibits low toxicity and good selectivity. Because penciclovir is absorbed poorly when given orally, it is more often used as a topical treatment. So lastly, we have your trifluridine. So your trifluridine is an antivirus or anti-herpes virus antiviral drug. So it is used primarily on the eye. So optical drug. So it was sold under the trade name Viroptic by Glaxo Wellcome, now merged into GlaxoSmithKline. So the brand is now owned by Monarch Pharmaceuticals, which is wholly owned by King Pharmaceuticals. So usual indications. So for your docosanol or your Abriva, it is a local treatment of oral and facial herpes, simplex cold sores, and fever blisters. For your ganciclovir or your Vitrasert, it is implanted for near I. It is implanted for treatment of CMV in patients with AIDS. For your imiquimod or your Aldera, it is a local treatment of genital and perianal warts. So for your penciclovir or your denavir, it is a local treatment of herpes labias or cold sores on the face and lips. For trifluridine or viroptic, it is an ophthalmic ointment to treat herpes simplex infections in the eye.
Antifungal systematic. So systematic antifungal agent can be generally grouped on the basis of the site of action of pathogenic fungi. So azole and fluorine antifungal agent exert their antifungal effect by targeting the structural and principal cell membrane cell of many pathogenic fungi. By inhibiting the 14A dimethyl lanosterol dimethyl fungal secrum depends enzyme azole antifungal agent displays cell membrane, ergoterol impair membrane fluidity and lead to accumulation of toxic of 14A, methylates sterol and resulting in growth arrest and eventual fungi cell death. However, this innovation is not entirely selective to fungi. Indeed, collateral inhabitants of the human CYP enzyme by azoles is often responsible for pharmacokinetic drug interaction. The fungal target for azole binding is heme containing pocket of the 14A demethylase enzyme. Fungi are metabolic similar to mammalian cell and offer a few immunogenic specific target. So how do systematic antifungal work? So systematic antifungal drugs are used to treat systematic mycosis, which are fungal infection affecting internal organs. The infection-causing fungi enter the body via the lungs through the gut, paranasal, sinus, or the skin, and can spread through the bloodstream to multiple organs, including the skin, often causing multiple organ failure and eventually resulting in death. So, drug for systematic antifungal treatment includes polyene microlides such as amphotericin B and lipid formalization, and various azole derivative, fluconazole, isafuconazole, and itraconazole. Also, the echinocandins, anidolafungin, casfofungin, and minafungin, allylamines, such as terbinafine and griseovolin and flucytosine. Polyene microlides, such as amphotericin B and nystatin, are important antifungal agent that has the fast fungicidal effect, broad spectrum of activity, and very low tendency of resistance development and among fungal pathogens. Amphotericin B works by binding with ergoterol, a component that maintain the integrity of the fungal cell wall and form pores in the wall. This casual leakage of cellular ion, which lead to fungal death. Amphotericin B is an effective but relatively toxic drug and has long been mainstay of antifungal therapy for invasive and serious mycosis. Azole antifungal. The work primarily by inhibiting the cytochrome P450 depends enzyme lanosterol 14-alpha demethylase. This enzyme is necessary for the conversion of lanosterol to ergonerol, a vital component of cellular membrane of fungi, disruption in this and is collateral causing the damage of the cell membrane by increasing its permeability, resulting in cell lysis and death. Despite this mechanism of action, and triazole and generally considers as fungistatic against the Candida species. Echinocandins work by inhibiting the glucostate transferase enzyme 1/3 by BD-glucan synthase, which is essential for regeneration of 1,3 glucan, an essential component that maintain the integrity of the fungal cell wall. The inhibition of the organism to synthesize the glucan lead to osmotic instability and cell death. The spectrum of activity of echinocandins is limited to pathogens that rely on this glucan polymer. candies exhibit a fungistic activity against the Aspergillus species, whereas they exhibit the fungical allylamines work by inhibiting by ergosterol synthesis by inhibiting the enzyme squalane epoxidase, which catalyze the conversion of squalane to lanosterol and further convert to lanosterol to ergosterol, a major component in the fungal cell wall. The inhibition of this enzyme causes the squalane substance toxic to fungal cell to accumulate intracellularly and lead to rapid cell death, and absence to ergosterol cause the damage to the cell membrane, increase the permeability, and lead to cell Griseovolvin. Griseovolvin is considered to be fungostatic even though the exact mechanism of the action against the dermatotic is not clear. It is true in inhabitant fungal cell mitosis and unclear acid synthesis. It also binds the interfere with the function of spindle and cytoplasmic microtubules by binding to alpha and beta tubulin. The exact mechanism of the action of the tocytosine is unknown. It has been proposed that the fluorescent act of direct on fungal organism by competitive inhibition of protein and pyrimidine uptake, and indirectly by intracellular metabolism to the 5-fluorouracil tocytosine enter the fungal cell via cytosine. Permits those fluocytosine is metabolism to 5-fluorouracil within the fungal organism. The 5-fluorouracil is extremely incorporated into fungal RNA inhabitants and synthesis of both DNA and RNA. The result is unbalanced growth and death of the fungal organism. It also appears to be fungal thymidylate synthesis.
How are systemic antifungal used? Systemic antifungals are available in various forms such as intravenous agents, oral tablets, oral suspensions, cream, gel, foam, and shampoo. They are used to treat several fungal infections including fungal endocarditis, inflammation of the inner lining of heart, chambers, and valves. Aspergillosis mold, a type of a fungus infection, usually affects the lungs. Histoplasmosis, a type of lung infection caused by inhaling Histoplasma capsulatum fungal spores. And we also have gastrointestinal candidiasis, fungal infection caused by Candida fungi. Systemic candidiasis, Candida infection spreads throughout the body. Blastomycosis, fungal infection caused by inhaling fungus, Blastomyces dermatitis. Prophylaxis for invasive fungal infections, ringworm, a highly contagious fungal infections of the skin or scalp. Generic and brand names of systemic antifungals. Anidolafungin, Araxis ang iyang brand names. We also have Caspofungin, Candida ang iyang brand name. Fluconazole, Diflocan ang brand name. Usocanazole, Noxafil ang iyang brand name. Terbinafine, Lamisil ang iyang brand name. Furiconazole, Vifend ang brand name. Micafungin, Mycamine. Side effects of systemic antifungals: alopecia, loss of hair, chapped lips, skin toxicity rash, photosensitivity, inflammation of the skin when exposed to ultraviolet rays, photophobia, sensitivity to bright light, periosteitis, inflammation of the layer present around the bone, gastrointestinal symptoms, nail changes or loss, nausea and vomiting, headache, severe itching, and depression. And we also have the serious side effects of systemic antifungals. We have cardiac arrest, elevation of liver enzymes, hepatitis, auditory hallucinations, visual hallucinations. The effect of antifungal agents on the other therapeutic regimens merits serious consideration when therapy is being initiated or discontinued. Antifungal drugs can alter the safety or efficacy of concomitant therapies through several mechanisms. The first of those involves additive toxicities associated with concomitant administration. The most apparent example is nephrotoxicity caused by amphotericin B. This toxicity can enhance the renal effect of many other agents, including cyclosporine and the aminoglycosides. Metabolism and elimination. Many systemic antifungal agents undergo some degree of hepatic metabolisms before elimination. One notable exception is flucytosine, which is not known to be metabolized hepatically because urine excretion of unchanged drug accounts for 190% of its elimination. For the amphotericin B products, the exact routes of metabolism and eliminations are largely unknown. All azoles antifungals undergo some degree of hepatic metabolism. For fluconazole, the role of metabolism in drug elimination is minimal, but this is not the case with itraconazole, voriconazole, and posaconazole, which are highly dependent on metabolism for drug elimination. Itraconazole, voriconazole, and posaconazole, which are highly dependent on metabolism for drug elimination. Next is the effect of organ dysfunctions on drug dosing. The effect of organ dysfunctions on the elimination of the antifungal agents. Although the various formulations on amphotericin B are known for their ability to cause nephrotoxicity, and they do not require dose adjustment for patients with decreased renal function. In fact, of all the available systemic antifungal agents, only fluconazole and flucytosine require dosing modification when given to the patients with decreased levels of creatinine clearance.